Welcome back to Great Day Houston Medical Monday. From heavy burning legs to leg ulcers that won't heal, disease of the arteries and veins have a lot of symptoms and cause a lot of problems. Joining us with how to easily identify and treat the issue is Dr. Rajiv Agarwal with Modern Heart and Vascular Institute. Good morning.
Good morning, Deborah. How are you?
I am good. All right. The circulatory system is like a vast highway system that carries our oxygen and nutrients throughout our body. It's crazy. 60,000 miles worth of it. Remind us of what arteries and veins do, because they both kind of have a different function.
Absolutely. So the arteries take blood away from the heart and give blood, say, in the legs all the way to the toes. And the veins bring it back. So the way we teach our patients is AA, arteries away from the heart, BV, the veins bring the blood back to the heart.
All right. If arteries have poor circulation, what are some of the symptoms that people need to be aware of?
So for arteries, it's usually due to blockages, Deborah. So the symptoms that they would get is with exertion. So if they get any fatigue in their legs, tiredness, numbness, burning with physical activity, that's usually arterial, whereas venous disease tends to happen more at rest. So if people get any cramps, Charlie horses, swelling, restless legs, people are often misdiagnosed with neuropathy or restless leg syndrome, where it's actually circulation issues and not those conditions.
Yeah.
So artery symptoms more with exertion, vein symptoms more at rest.
Yeah, and some of those vein symptoms, I know when I've seen people have those open sores or ulcers on their legs, and they keep thinking it's a dermatology issue, but it never goes away. That also could be venous disease, correct?
That is correct. We have seen people with bad ulcers, bad swelling. As a matter of fact, just this week, yesterday I saw patient, actually Saturday, I saw a patient who had a lot of swelling and starting to have ulcers on their feet. And I told him, look, very likely it's circulation problems, and very likely within a few weeks it'll heal up and go away. He's been getting therapy for months and it's just not improving because it's a venous ulcer and he's getting the wrong kind of treatment for it.
All right. Arterial disease, what are some of the risk factors?
So the risk factors for arterial disease, because it's blockages, are similar to what you get with blockages in your heart. So smoking, high blood pressure, diabetes, high cholesterol, a lack of physical activity, genetics plays a big role into it. So all the traditional risk factors for blockages.
All right. And then with venous disease, risk factors similar or a little bit different?
Very different. Venous disease, it's more of gravity dependent. So people that are overweight, people that are on their feet quite a bit, so secretaries, teachers, flight attendants, store clerks that are having the effects of gravity on their legs. And then there's hormonal replacement therapy, the estrogens that affect that as well. But mostly it's a gravity dependent phenomena, Deborah.
Yeah, you mentioned that most people are misdiagnosed, but when they come to you, it's an easy diagnosis and non-invasive.
Correct. So the first step is we talk with them, we listen to them, and we see if their symptoms are more at rest or with exertion. And then we do a very thorough physical examination on them, really examine their legs to see what the issues are on hand. And then if needed, then we do a non-invasive ultrasound of their legs to check the circulation going south, which would be the arteries, and the north circulation, which is the veins coming back to the heart. And that will tell us what the issue is and how to proceed from there.
Yeah, and if someone has blockage, pretty quick procedure that you can do to take care of that.
Yes, the blockages are easy. You get a roto-rooter or what's called an atherectomy, but basically you're opening up the blockage. Sometimes you get a stent, sometimes you don't need a stent, depending on the location and size of the blood vessels. So the blockages can be fixed in the cath lab very easily.
And with vein disease, there are some simple things that people can start with. The compression socks, leg elevation, just losing weight. But there's some other vein treatments that you have as well.
Right. Once they've tried the non-invasive, the conservative therapy, let's call it, with the compression stockings and leg elevation, those are really Band-Aids, Deborah. What really works is a cure, which is a vein therapy. There are three ways to do that. One is with heat, one is with foam, and one is with glue. They're all very similar in efficacy. Sometimes certain insurances cover one and not the other. But the goal of the therapy is to close down the veins that are not behaving properly. The example I give to my patients is, say you're driving on 59 and there are 5 lanes, but one of the lanes is allowing you to drive both ways in the same lane. So what we do is we shut down that lane and say, okay, guys, no one's allowed to get on that lane of the highway, and you have to use the 4 other lanes. So with vein disease, with heat, glue, or foam, you're shutting down that vein that's leading to all the troubling nights of restless sleep, and we fix the veins, and these people come back to us and say, oh my God, I feel amazing. I'm getting a good night's sleep. I wake up refreshed and my leg symptoms are gone.
Yeah, and they even look so much better. We saw that picture earlier. Just aesthetically, you can tell how things have been taken care of. All right, restless leg syndrome and swelling, those are two things that also bother people. You treat that as well. The bottom line is, like most situations, most health situations, the longer you wait, the tougher it is to treat. So you suggest that if you have those early symptoms, to get in now. And of course, if you're advanced, you all are also equipped to deal with that as well.
That's correct. A lot of people have been ignoring symptoms, especially during COVID times. A lot of us were told not to get out, not to socialize, so we stayed at home and we sat and watched TV or worked on the computer. And a lot of people have developed a lot of symptoms in their legs that they're ignoring. But we would encourage them to seek help from us or someone else where they can get relief of their leg symptoms, because long term, it's a problem. These ulcers can turn into wounds that just won't heal. But help is available right now.
Yeah, that could lead to amputations even. Dr. Agarwal, thank you very much.
Thank you, Deborah.